Homeless crisis in Canada, 2024. A growing homelessness problem. The homelessness crisis in Canada is worsening like never before, with alarming forecasts for the future. An artificial intelligence, AI algorithm from HelpSeeker, a tech company specializing in social issues, has warned that homelessness in Canada could nearly double by 2030. These predictions are based on factors such as inflation, unemployment, the housing crisis, and significant population growth. We are facing a future where homelessness could become an uncontrollable issue without timely interventions. According to projections from Homeless Hub and HelpSeeker, the current number of homeless people in Canada is around 335,000. By 2030, this number could rise to approximately 570,000, a nearly 83% increase. This AI algorithm not only considers population numbers, but also factors in housing trends, unemployment rates, and access to social services. With Canada's population expected to grow from 42.9 million to 52.5 million by 2043, the housing crisis is becoming increasingly severe and evident. Recent statistics show that each night, about 55,000 people in Canada are homeless. Throughout the year, at least 335,000 people experience homelessness, with most relying on emergency shelters. Specifically, 245,000 people use shelters like women's refugees, while around 75,000 find temporary shelter through non-profit organizations or with acquaintances. Unfortunately, up to 15,000 people are forced to sleep on the streets, facing dangerous and harsh living conditions. Homelessness affects various groups in society, but some populations are more vulnerable than others. Single adult men, individuals with mental health or addiction issues, women with children fleeing violence, and Indigenous people are among the most at risk. Notably, adults aged 25 to 49 make up 52% of the homeless population, while older adults aged 65 and over represent a small percentage, under 4%. However, trends show that the number of older adults and those aged 50 to 64 using shelters has been increasing over the past decade. The main causes of homelessness in Canada. Homelessness in Canada is not a simple issue. It is the result of many interconnected factors, making it difficult for people to maintain stable housing. Economic struggles are one of the main drivers of homelessness. High living costs, unemployment, and stagnant wages leave many people unable to keep up with rising rents. Meanwhile, the lack of affordable housing exacerbates the crisis. Major cities like Vancouver and Toronto are experiencing skyrocketing housing prices, creating immense pressure on low-income individuals. Rental costs have far outpaced income growth, leaving many unable to find affordable places to live. Beyond economic issues, mental health challenges and addiction are deep-rooted causes of homelessness. People dealing with these conditions often lose their ability to maintain steady employment and struggle to access the necessary support services. The healthcare system is not yet effective or affordable enough to address these problems, creating a vicious cycle from which many cannot escape. Family breakdowns and personal relationship issues are another significant factor. Strained relationships can push people out of their homes, leading to homelessness and a lack of support networks. Women with children fleeing domestic violence are particularly vulnerable and at high risk of becoming homeless. Moreover, the rising cost of living affects more than just housing. Basic necessities like food, healthcare, and transportation are additional burdens for many low-income workers. They face tough choices between paying for essential services or maintaining stable housing, pushing them to the brink of homelessness. This precarious living situation makes it difficult for these individuals to access job opportunities, education, and social services, worsening their circumstances. A recent survey in Toronto revealed that on the night of April 26, 2020, approximately 10,715 people were homeless, with 3,118 people temporarily living in refugee and asylum shelters. However, these surveys often do not fully capture the situation, particularly hidden homelessness, which commonly affects women and youth, who are less likely to appear in statistics. Who experiences homelessness in Canada? One of the most affected groups in Canada's homelessness crisis is Indigenous peoples, including Inuit and First Nations communities. While Indigenous peoples make up about 4.3% of Canada's population, they account for 28% to 34% of the homeless population living in shelters. This stark disparity highlights a severe inequality, as urban Indigenous people face a much higher risk of becoming homeless compared to other groups. Research shows that on any given night, approximately 6.97% of the urban Indigenous population in Canada is homeless, compared to a national rate of just 0.78%. This means that 1 in 15 urban Indigenous people faces homelessness, compared to 1 in 128 non-Indigenous individuals. In other words, urban Indigenous people are 8 times more likely to experience homelessness than the non-Indigenous population. Major cities like Vancouver, Regina, Saskatoon, Winnipeg, Toronto, Ottawa, Val-d'Or, and Montreal have significant Indigenous homeless populations. In Montreal, the homeless Inuit population is notably higher than average, exacerbating the homelessness crisis in these cities. This situation reflects not just a housing shortage, but also the consequences of social inequality, discrimination, and the mental health and addiction challenges that Indigenous people face. The lack of access to essential support services, combined with historical injustices toward Indigenous communities, has trapped them in a cycle of homelessness. Youth and homelessness. Youth aged 13 to 24 make up 18.7% of Canada's homeless population, highlighting an alarming group that faces unstable housing. Even more concerning is that the majority belong to vulnerable minority groups, with 29.5% of homeless youth identifying as LGBTQ2S, 30.6% identifying as Indigenous, and 28.2% belonging to ethnic minorities. Regarding gender, 57.6% are male, 36.4% are female, and 1.8% are transgender or two-spirit, with the remaining small percentage identifying as non-binary. These statistics illustrate the diversity and complexity within the homeless youth population, who face numerous social and cultural barriers. A 2020 study revealed that 40.1% of homeless youth had experienced homelessness since childhood, under the age of 16. This means many of these young people grew up in unstable and vulnerable environments. Street-involved youth are 10 to 12 times more likely to contract sexually transmitted diseases and infections than other teens in the general population. They also face an 11 times higher risk of death by suicide or drug overdose, and 45.8% of them have injected drugs, placing them in an extremely vulnerable health group. Women and homelessness. Women represent about 27.3% of the homeless population in Canada, and their experiences differ significantly from those of men. Homeless women face higher risks of violence, assault, sexual exploitation, and abuse. Many women become hidden homeless, avoiding official shelters or living on the streets by staying in unsafe places to escape domestic violence. Domestic violence is one of the leading causes of homelessness among women. Additionally, gender inequality in the labor market, with lower wages and many women heading single-parent households, makes them more likely to fall into poverty. This directly affects their ability to afford housing, food security, and health care. Minority women, immigrant women, and Indigenous women also face additional systemic barriers, worsening their homelessness situation. These women are at higher risk due to a combination of discrimination, social injustice, and a lack of support from the social safety net. The rest of the text would continue with similar restructuring, addressing other sections like mental health and homelessness, single adult men and homelessness, and homeless shelters in Canada, with an emphasis on correcting grammar, spelling, and cultural nuances to align with U.S. English conventions. If you need more help with any specific part, let me know. Mental health and homelessness. Mental health is closely tied to the issue of homelessness in Canada. Homeless individuals often face loneliness, social exclusion, and psychological stress, which can worsen their mental health. Conversely, poor mental health contributes to poverty, social disconnection, and vulnerability, all of which can lead to homelessness. Studies show that 30% to 35% of homeless people have mental health issues, and this figure rises to 75% for women. Another significant percentage, around 20% to 25%, suffer from both severe mental illness and addiction, making it harder for them to stabilize their lives and access necessary support systems. The combination of homelessness and poor mental health creates a vicious cycle, where each condition reinforces and worsens the other. Single adult men and homelessness. Single adult men make up the largest and most visible demographic of homeless individuals in Canada. These men, primarily aged between 25 and 55, accounted for 47.5% of the total homeless population from 2005 to 2009. They are a vulnerable group, struggling to find stable housing and access social support. These men face not only economic issues, but also psychological pressures, especially when dealing with job loss, family breakdowns, or the loss of social support networks. Many also struggle with addiction and mental health issues, which further complicates their ability to reintegrate into society. Homeless shelters in Canada. Fortunately, the Canadian government has made efforts to combat the homelessness pandemic. One of the key resources for homeless individuals in Canada is the network of emergency shelters that operate 24/7. In 2022, there were 423 emergency shelters nationwide, providing 16,627 permanent beds. Some shelters are designed specifically for men or women, but about 37% serve both genders. Additionally, youth shelters account for 22% of the total, highlighting a focus on supporting this vulnerable demographic. However, the distribution of shelter beds is uneven, with 90% located in the provinces of Ontario, Quebec, Alberta, and British Columbia, 44% of which are in Ontario alone. This creates a significant shortage in the remaining provinces, which still face a homelessness crisis but lack sufficient support infrastructure. Toronto has made efforts to address homelessness with varying levels of success. The city has the largest shelter system in Canada, providing accommodations for approximately 6,800 homeless people across 75 permanent and 26 temporary locations. These locations, especially the temporary shelters, were added during the winter of 2022-2023 to meet urgent needs during cold weather. However, the emergence of makeshift homeless camps across major cities has posed new challenges, as officials have struggled to respond quickly, leading to ongoing displacement of homeless individuals without long-term housing solutions. Despite efforts, Toronto continues to face a situation where around 40 people are turned away from shelters each night due to bed shortages, forcing them to sleep on the streets. Strategies for tackling homelessness in Canada. To meet the diverse needs of the homeless population, many non-profit organizations have emerged, offering short-term, medium-term, and long-term solutions. One of the main strategies being employed is tailoring shelter services to specific groups such as men, women, families, youth, or Indigenous people. These shelters not only provide a place to sleep, but also offer food, clothing, and support services such as laundry, legal counseling, and referrals to other relevant services. Some shelters have developed medium and long-term housing models that allow homeless individuals to stay for weeks or months. These shelters not only provide time for individuals to regain stability, but also offer support services like psychological counseling, harm reduction, and legal assistance. Some organizations have gone a step further by developing community-supported social housing, a highly sustainable solution that gives homeless people the opportunity to rebuild their lives in a safe and supportive environment. Government response and current solutions. Given the scale of homelessness across Canada, the question arises, what is the government doing to address this issue? One of the most notable efforts is the federal government's 10-year, $70 billion national housing strategy, aimed at reducing homelessness and improving access to affordable housing. A key component of this strategy is the Rapid Housing Initiative, which focuses on building affordable housing units across the country. Although thousands of homes have been built or are in development, the demand is growing faster than projects can be completed, leaving many people in precarious situations. In major cities like Toronto and Vancouver, local governments have funded emergency shelters, warming centres, and transitional housing programs. However, many shelters remain overwhelmed. For example, Toronto's shelter system frequently operates at over 90% capacity, and there have been multiple instances where families and individuals in need of support have been turned away due to a lack of space. Beyond housing, the government has also invested in mental health and addiction services, but the funding is insufficient to meet growing demand. Programs designed to assist individuals with mental health and substance abuse problems often face funding shortages and have long wait lists, leaving many without the help they need. Meanwhile, non-profit organizations are working to fill the gaps. Charities provide food, shelter, and counseling to homeless individuals. However, these organizations are under immense pressure as the crisis continues to escalate and resources remain limited. What needs to change? To reverse the situation, Canada must act swiftly and decisively in several key areas. Increase investment in affordable housing. While the National Housing Strategy is a step in the right direction, the pace of construction is not keeping up with demand. There needs to be a greater focus on building long-term affordable housing, not just temporary shelters. The Housing First approach, which provides stable housing before addressing other issues, has proven effective and should be expanded nationwide. Improve mental health and addiction services. Many homeless individuals face mental health challenges or addiction issues but do not receive the necessary support. Canada must increase funding and expand these programs, ensuring immediate and long-term care is available. Integrating these services with housing initiatives will provide a more holistic approach to the crisis. Strengthen economic support systems. Too many Canadians are one paycheck away from losing their homes. Raising the minimum wage, expanding access to affordable childcare, and providing better unemployment benefits can help prevent homelessness. A robust social safety net will reduce the number of people falling into homelessness. Focus on preventative measures. High-risk groups like seniors on fixed incomes or youth aging out of the foster care system should be identified, and targeted support should be provided before they fall into homelessness. By addressing root causes such as poverty and the lack of affordable housing, Canada can reduce the number of people becoming homeless. The homelessness crisis in Canada requires coordinated and long-term action from the government, communities, and non-profit organizations. While current solutions show progress, they are not enough to tackle the scale of the problem. Only by addressing the root causes and providing comprehensive support can we turn the tide and bring hope to those facing homelessness.